The African Society for Laboratory Medicine, in collaboration with the U.S. Center for Disease Control and Prevention, is organizing a technical workshop on scaling up HIV viral load testing and uptake of the results through improving efficiencies of systems. Here to tell us a bit more about this is Dr. Simon Agolory, the country director of the U.S. Center for Disease Control and Prevention, as well as Dr. Ndapewa Hamunime, the Chief Medical Officer for HIV STI Subdivision at the Directorate of Special Programs under the Ministry of Health and Social Services. Doctors, good morning and welcome.
Good morning. Thank you for having us.
Dr. Agolory, I'll start with you. Perhaps you can explain to myself and to the viewers watching this morning, what exactly does viral load mean?
Thank you. That's a very interesting question. A lot of people don't know what that is. When someone gets infected with HIV, the virus goes all over their body. So some of it will go hiding, but most of it will circulate, attack our immune systems, turn them into little factories to make more viruses. And then when those viruses are released, those cells that release them are destroyed, and then the viruses attack more cells, turn them into more factories making more viruses. So the viral load test allows us to measure the amount of circulating virus in the blood, or what I call the active virus.
So besides what you've just mentioned, what the viral load testing is needed for, why else is it important to do viral load testing?
Because that's the only way we can know when someone is responding appropriately to treatment. If the virus is circulating and there's a lot of virus in the blood, that means more immune cells are being destroyed. When the number of immune cells become very low, someone becomes very vulnerable to infections. Things that would not normally make them very sick will make them very sick and can potentially kill them. So it is important to the clinicians who are taking care of the patient to know the amount of circulating virus so they can provide the appropriate care to the patient.
All right. Dr. Hamunime, over to you. Why is this meeting happening in Namibia?
You see, Namibia has become a model in HIV management and is one of the few, at least 3 African countries who have made progress so far in viral load testing. And this is in line with the WHO recommendation.
Why is it important for the Namibian public to know about this meeting, and also how can they get involved in it or be a part of it?
Yeah, it's very important for the Namibian public to know about the workshop, because this is a workshop which is aimed at increasing awareness about viral load testing, so that the public and those who are infected should also be part of the management of their own condition. And they should know, because they are confusing issues sometimes in the treatment. Some people think that when the viral load is suppressed and the doctor tells them so, they think they are cured. They think that they are HIV negative, which is not so at all. They still remain positive, even though the viral load is so low that it cannot be detected with the available technologies.
What are some of the consequences that you can speak to us about this morning, just briefly, of not having viral load testing done if you are HIV positive?
Yes, the consequence is that if the viral load is not monitored, one will never know if the medicines are working. So maybe it will be assumed that the person is fine, but in the meantime, the virus is multiplying in the body, and so the patient can get sick without us knowing to take measures to prevent a person getting sick. So if we detect that the viral load is high, is increasing, then maybe it's treatment failure, that the treatment is not working, or maybe the person is not taking the medicines properly, so that the clinicians can take measures to correct the situation. And because the idea is that the ministry is trying at least to prevent new infections, and also those who are already infected to prolong their survival rate so that no one dies from HIV. So we have made progress so far together with the collaboration of PEPFAR, that is President Emergency Plan for AIDS Relief, American President, the initiative. And now with this collaboration, Namibia has made many advances in HIV viral load testing. because we have, through PEPFAR, we are able to recruit 14 clinical mentors who will be deployed in all the 14 regions to help mentor other doctors and nurses in order to monitor the viral loads.
Dr. Agolory, back to you. Now, what are some of the factors? Now, Namibia continues to make efforts in this regard, expanding the viral HIV testing to HIV patients. But what are some of the factors that have hampered the access to all patients receiving this viral load testing?
So the viral load testing itself is very complex. You need some sophisticated machines to be able to do the viral load testing. The specimens have to be collected in a certain way and have to be transported to the lab. And usually you have to get them to the lab within 6 hours or so. So you can imagine some of the health facilities that are far away from laboratories, it's very difficult for them to do this.
And how are you trying to sort of mitigate this so that testing of viral testing is done, even within the rural areas where there are also individuals that are HIV positive and need this testing?
So PEPFAR has been working closely with the government of Namibia and NIP to decentralize laboratory services. Soon you will be hearing more about some laboratory facilities that will be open in different parts of the country to make it easier for those facilities that are far away to send the specimens there. We're also looking at some innovative strategies that will allow us to collect something called dried blood spots from some of the faraway facilities, and that can be shipped through regular mail, and we'll get it to the lab and still give us the same results. So we're very excited about it, and we think that we should be able to provide viral load testing to all patients in Namibia. And again, this is critical. I know Dr. Hamunime mentioned the importance of viral load testing. When it is suppressed, when someone has their viral load undetected, their risk of transmitting HIV to someone who is uninfected is almost zero. That could be their infant, their unborn infant, or their partner. And also their risk of dying from all-cause mortality is significantly decreased. So that's really why it is important for us to be able to do this test.
Right. Dr. Hamunime, what are some of the milestones for Namibia when it comes to viral load testing? Okay.
Some of the milestones is that at least we have now SMS printers which enable all the sites to access the result immediately. They can, instead of like in the past, people wait for the results to come from the main sites, being delivered by cars. So now they can print themselves just there, and they see what are the results saying of the viral load. So this is, and it will be expanded to reach even smaller clinics so that they have SMS printers and they don't have to wait for long. And also, we have implemented ECHO project, which is a learning program whereby people at different sites are connected at once, and then they can discuss their issues, they can discuss the viral load of their patients, they can discuss those who are failing or who are suspected to be failing, and then they can learn from each other, they can get advice immediately together, concurrently. So these are some of the milestones, and as Dr. Agolory already said, that there will be containers, laboratory containers which are mobile, which will be also decentralizing the lab.
All right. Dr. Agolory, just in closing, who will be attending the workshop, and maybe you can just highlight one or two key issues that will be addressed?
Sure. We're very excited that the workshop will be attended by representatives from 11 countries, including South Africa, Botswana, and Nigeria. We will also have representatives from World Health Organization Geneva, World Health Organization the Afro region from Brazzaville, and other multilateral organizations. The key thing that will be discussed among this is identifying efficiencies. As I mentioned earlier, the viral load testing itself, it's very complex, but we're going to discuss how countries can identify efficiencies that will allow them to scale up viral load testing. We will also look at cost-saving initiatives, things that can be done that will allow more people to be tested. Right. So we're very excited about this. Yeah.
Fantastic. Well, doctors, thank you so much for joining us this morning on the show.
Well, thank you.
Thank you for having us.
That was Dr. Simon Agolory, the Country Director of the U.S. Center for Disease Control and Prevention, as well as Dr. Ndapewa Hamunime, the Chief Medical Officer for HIV